Today we will discuss about the breast complication during the postnatal period. You all know what is the postnatal period. It is a period which start after 24 hours of the delivery to the 42 days of the delivery, that is known as the postnatal period. What complication occurs during this period, that is we'll discuss later on. The first we will should know what is the breast complication. This breast complication which is occur during the postnatal period common during the early week of the postpartum. This complication occur commonly in early week of the postpartum period. It can disturb the breastfeeding and infant nutrition. So weight gain is one of the problem due to this breast complication. Important for the nurses to recognize early sign and manage effectively. So being a nurse, she should know what is the complication when it occurs, what is the sign and symptom of that complication, and how she can manage effectively. So there are following complication which is occurs in the postnatal period. One is the breast engorgement, second one is the cracked and retract nipple, third one is the mastitis. Next one, the breast abscess, lactational failure, cracked nipple, retract nipple, plug ducts, breast abscess, low milk supply and over milk supply. This is the breast complication which is occurred during the postnatal period. So first we will discuss of the first complication, that is the breast engorgement. Breast engorgement occurred due to the overstress of the normal venous system in the breast. Due to that, there is the breast milk. Due this, the breast milk is not escaped from the lacteal system, that will remain inside the lacteal system. Breast engorgement occurred due to the less intake of the breast feed by the newborn. So when newborn is not able to take the adequate breastfeed, that will lead to the breast engorgement. When breast engorgement occurs, when we will see the mother, there can be a breast engorgement. So it will occurs after the milk secretion started, that is the 3 to 4 days after postpartum period, because first to 3 days is the secretion, that is known as the colostrum. So after 3 to 4 days, there will be a chance of the breast engorgement. So what is the sign and symptom of the breast engorgement? The first sign and symptom is considerable pain. There will be pain, feeling of tenderness. When we will examine physically the mother, there will be a tenderness, feeling of the heaviness. Mother say, my breast is so heavy in both breasts. Generalized malaise, raise of the temperature will be raised. Painful breastfeeding, when she fed the baby, at that time she feel pain. Tight, their breast will be a tight shiny skin, and flattened nipple making latching difficult. When there is the size of breast will be increased, due to that milk is accumulate within the lactic system of the breast. Due to that, there will be a difficulty in breastfeeding. So what is the prevention of the breast engorgement? How we will prevent there should be no breast engorgement? Firstly, avoid pre-lactal feeding. But there is a culture, or some mother will give the artificial feed to the baby, so we will not give, just like honey, Baljivan Gutti, that we should not give pre-lactal feed to the baby. Due to that, baby will not attach with the breast. In initiation of the breastfeeding, अर्ली इंसेशन ऑफ द ब्रेस्ट फीडिंग, हमें जल्दी से जल्दी बच्चे को ब्रेस्ट फीड पे लगाना चाहिए. नॉर्मल डिलीवरी में, वजाइनल डिलीवरी में हम हाफ एन आवर्स के बाद ब्रेस्ट फीड करवाना चाहिए, एंड सिजेरियन सेक्शन में आफ्टर 1 आवर्स के बाद बेबी को जो है ब्रेस्ट फीड पे जो है लगाना चाहिए. सो अर्ली इंसेशन इज वन इम्पॉर्टेंट कारण, वन इम्पॉर्टेंट थिंग्स विच विल हेल्प टू prevention of the breast engorgement. Feeding on demand, we should feed the baby on demand, feeding in correct position. So there should be a correct position. So that will help in prevention of the breast engorgement. So what is the treatment of the breast engorgement? So first we will support the breast with binder or brazier. So we will educate the mother, use binder or brazier to support the breast, because when breast is become larger, or that will um, give the pain to the mother, or even more milk accumulate into the breast. Manual expression of remaining milk after each feed. When mother feed the baby is not able to empty the breast, so mother will express their milk, remaining milk from the breast. Administer painkiller medicine. So we will give the mother, we will advise the mother to take some painkiller, because there will be a pain if there will be a engorgement of the breast. Provide breast milk regularly and frequent. So educate the mother for regular breastfeeding and frequent breastfeeding. Gentle use of the pump. We will not use the pump harshly. So gentle use of the breast pump will help to excretion of the milk from the breast. Reduce the tension of the breast with causing excessive milk production. Encourage frequent breastfeeding. Cold compression between the breastfeed can be given to the mother. Genital breast massage can be given to the mother. It will help to excretion of the milk from the breast. Next complication is cracked nipple and retract nipple. Why nipple will be cracked? In that it become painful due to loss of surface epithelium with the formation of the raw area over the nipple. It due to fissure either at there will be a fissure either at the tip of the breast or base of the nipple. Tip of the nipple and the base of the nipple lead to the cracked nipple. Unclean hygiene resulting formation of the crust over the nipple. The next complication is retracted nipple and trauma. From the base of the mouth due to the incorrect attachment to the breast, the infection goes to the deep tissue and lead to the mastitis. What is the cause of the retracted nipple? There is a poor latching. When we are not attached the baby to the breast adequately, at that time there can be a chance of the retracted nipple. Incorrect, it is the one of the cause of retracted nipple. Incorrect position, when we will not the correct position of the mother and the baby, and this video already given to the given in YouTube, how to breastfeed the baby and which positioning we will apply during the breastfeeding. So position of the mother and breastfeeding already given in the YouTube. Nipple trauma can be lead to the retracted nipple. What is the management and treatment of the retracted cracked nipple? So cleanliness during pregnancy and during the breastfeed. Before feed, cleanliness will help to prevent the crust formation over the nipple. So if it is the management of the cracked and retract nipple, local cleanliness during pregnancy, during breastfeeding, before feeding, cleanliness will prevent the crust formation over the nipple. So treatment, which treatment we will give to correct attachment. So when there is a poor attachment of the baby to the nipple, that will lead to the cracked nipple. Early pain, from painkiller, analgesics should be given to the mother to reduce the pain. Rapid healing, so we will apply fresh human milk, saliva, and purified lanolin application should be given to the mother over the breast 3 to 4 times. It will help to promote the healing of the breast. Use breast pump for expression of the milk. Treatment of all thrush by metronidazole solution applied over the nipple, and rest should be given to the affected nipple. If the baby have the oral thrush, so we will give the metronidazole solution that will apply over the nipple of the mother, and that breast should not be given to the baby. So we will give the rest to that nipple. Next one is the acute mastitis. Acute mastitis in the postpartum period is an inflammation of the breast tissue, often caused by infection. It is common in the breastfed woman, typically within the first 6 to 8 weeks of the postpartum. Mastitis is inflammation of the breast tissue, may be progressed to abscess if not treated. So this is the definition of mastitis. What is the cause of mastitis. So we already discussed in the definition there will be infection. So the infection can be bacterial, that is the Streptococcus aneurisys, Streptococcus epidermis, Streptococcus viridine, milk stasis when milk is stagnated into the lacteal system, poor lunch, poor breastfeeding technique, cracked nipple and breast engorgement, that all will lead to the mastitis. So what is the sign or symptom of the mastitis? Breast pain or tenderness, swelling, redness, warmth, fever, flu-like symptom. When we will give the physical exam, do the physical examination of the mother, there will be a tenderness, there will be a swelling, redness, warmth, and mother will explain regarding the fever and the flu-like symptom. Treatment. So the treatment of the mastitis will be antibiotic if there is bacterial infection. So we will give the antibiotic according to the laboratory investigation. Analgesic should be given to the mother to reduce the pain, encourage breastfeeding because it will help in early empty of the breast, prevent abscess formation. When there will be a bacterial infection, there will be a chance of the breast abscess. Continue breastfeeding, that will have to empty the breast. Warm compression, it is vasodilator. Pain reliever medication can be given. Rest should be given to the mother and adequate hydration should be given to the mother. Mother should not be dehydrated. So how to prevent the mastitis? Proper breastfeeding techniques, frequent feeding, good nipple care, avoid tight clothing. If you suspected acute mastitis, so mother should consult their health care provider. That can be doctor and that can be nurse. The next one is the plug ducts. So what is the definition of the plug duct? Blockage in the milk duct causing the localized pain and swelling. What is the cause of the plug ducts? That is the poor lunch, infrequent feeding and tight clothing. This is the cause which will lead to the plug duct. Sign and symptom, there will be a pain, swelling and lump in the breast. During physical examination, we can see the swelling and the lump in the breast. What is the management? We should apply the warm compression, massage. We should give the massage to the breast, gentle massage and frequent feeding should be advised to the mother to reduce the plug duct. Now the next complication is breast abscess. What is the definition of breast abscess? The abscess means a collection of the pus into the breast tissue is known as the breast abscess. What is the cause? Untreated mastitis. We already discussed it in the topic of mastitis. There will be an infection that will be in the form of bacterial infection. What is the sign and symptom? There will be a pain, there will be a swelling, there will be a redness, and mother will explain regarding the fever warmth. Next, management, we will give the antibiotic. If possible not reduce, then we will put the drainage to the, we will give the incision and drainage the pus from the breast, and medical attention should be given to that patient. There will be sometime there will be a daily dressing should be done. Next one is the low milk supply. What is the cause of low milk supply? The cause of low milk supply can be hormonal imbalance, infrequent feeding, and stress. What is the sign and symptom of the insufficient milk production? As per the history of the mother will told us there will be no milk in the breast. Low weight gain in the baby, or baby will not gain the weight as per the parameters. Now the management, frequent breastfeeding, skin to skin contact, and glucose. Overproduction. What is the cause of overproduction of the milk in the breast? That is the frequent feeding and hormonal imbalance. What is the sign and symptom? There can be due to that overproduction. There will be engorgement, discomfort, and milk will leak from the breast. The management, expressing the milk को बाहर निकाल देना है. Cold compression can be given, and the adjusting the feeding frequency. So we will adjust the feeding frequency. Will be 1 hour, 2 hours, and after 3 hours we will provide the breast to the baby.